looking back over the last century, we've really, as a health industry, made great gains around whether it's antibiotic therapy or vaccines, reducing spread of certain infections and diseases that really hindered quality of life or length of life in the past. But unfortunately, a lot of these gains have not been experienced across different populations. So I want to emphasize again that CMS and Joint Commission view this as a high priority. So the Joint Commission standards, just recently revised in January of 2023. This is definitely not fully comprehensive, otherwise this slide would have been impossible for people to read. But I think it captures key ways that as an organization, we have really put advancing health equity at the forefront, that we've developed a solution that is aimed at helping you advance health equity.
A little bit about Evara Health. We are an FQHC, federally qualified health center. We're located in Pinellas County, Florida, which is a peninsula with just under 1 million people. And we're actually the most densely populated county in the state of Florida. So as an FQHC, we handle a slightly different population than your typical healthcare organization. Started out on our RPM journey. We looked at how do we initially identify patients that might benefit from RPM services. We started our journey back in Q1 of 2022. So we've been on the journey for a little over a year and a half.
Just a little bit about our workflow. The ultimate goal, again, is to get patients to manage their health conditions, get patients to take their medications, monitor their vitals and their blood flows, complete their follow-ups, like be more involved in their healthcare, because when they're more involved, we have better outcomes. The results speak for themselves, like it's working. But based on the patient feedback alone, we see improvements. Patients feel better that someone is watching out for them, and they're learning about how their lifestyle choices are going to affect their vitals. So I think our biggest challenge was we took a lot longer to get our first cohort of patients than we thought it was going to take. Patients who have 3 or more chronic conditions. And then, we did encounter some challenges getting patients to agree and to sign up and just generally be interested. Make sure that you are flexible and communicate, because there's a lot of moving parts to a program like this, and you want to make sure that everyone is always on the same page. And that just kind of leans into our recommendations for any program that you might begin related to RPM. Be flexible, communicate, make sure that you have really clear criteria for which patients are going to qualify or who's going to get the most benefit.
RPM technology is really a huge win for our patients as well as our own organization. And so, you don't have to start out big. You can start out small and then build from there, which is what we did.